Hello, dear doctors. Today we'll discuss Minicase on page number 94 in first aid about 45-year-old male with pain in his lower back and legs. And as always, we'll start with our differentials. I'll give you some comments during typing, and at the end we'll discuss supportive findings for our diagnosis. So the first differential is lumbar spinal stenosis. Second one is peripheral vascular disease. And immediately we add our chief complaint everywhere. And let's say the third one is lumbar muscle strain. Okay. Now let's go to history. Time characteristics. Without precipitating events. And often lumbar spinal stenosis is accompanied by some weakness or numbness. But let's say he does not have any weakness or tingling. You have to ask about fatigue and fever because you have to be concerned about cancer, which often metastasize in spine. No prescribed or over-the-counter medications. Let's say he has history of rheumatoid arthritis in his mother and BPH in his father. sexual history. And we have one more line, but we can type here to save space. And let's go to our physical findings. Range of motion, six directions, extremities, dorsalis pedis and posterior tibialis are enough. And neurological exam. LE for lower extremities. And for all cases of back pain, straight leg rise test. So now let's fill our differentials with history and physical findings. So lumbar muscle strain is usually has some precipitating event. We can't put it here, that's why. Those two first differentials are usually intermittent pain. This goes here and here. Not sometimes here also. Elevation by sitting and leaning forward is characteristic for spinal stenosis only. Same is for right calf numbness. So because our patient does not have any fatigue or fever, we can exclude so cancer diagnosis is unlikely. That's why this one is our pertinent negative finding. And for peripheral vascular disease, we can add smoking history or just say smoking history. And occupation is a risk factor for muscle sprain. And now let's go to our physical exam findings. So this tenderness is not characteristic for spinal stenosis. That's why it's pertinent negative. It's characteristic for lumbar muscle strain, and also we can add it here. Full range of motion. So first two differentials have full range of motion usually. And vascular exam is normal in patients with lumbar spinal stenosis and muscle sprain. Impaired sensation, so it will go here. And the last finding is negative leg rise, which is characteristic for disc herniation. So those are our findings for physical exams. And now we can continue with our diagnostic study. And for peripheral vascular disease, we have to add ankle brachial index. That's it.